I am Morrowind Cameron, and this is The Conduit. All right, everyone. It is 1 p.m. in Kitsap County, 56 degrees. They say it's blustery, kind of windy. We're dealing with a bomb cyclone. Never heard that term before. That's something new for me. And I've been watching the weather people for a long time. So very interesting. Make sure that you are prepared. I think we'll be dealing with this for a few days. But we have a special guest today, Lindsey Camarena, coming to us from Kitsap Public Health with a new series that we're starting. So we're excited to have her on today to give us an update and educate us. So I'm really excited about that. So let's go ahead and bring her on. Lindsey, how you doing today?
Hey, Marwan. I'm doing well. Thank you. Thanks for inviting me onto the podcast to talk.
Yeah, absolutely. And would you just mind, introducing yourself to everyone since it's your first time on?
Absolutely. Sure. So my name's Lindsey Camarena, and I'm a public health nurse here at KPHD, your local health jurisdiction. I'm also a COVID ICU nurse. So kind of what my responsibilities are as far as work in the ICU, I am part-time there on the weekend, but my day job, my week job is here at the health district, helping to set up vaccine clinics. I'm a part of the community education outreach, and really just trying to keep our community safe as we navigate the pandemic. So it's a constant change, as you probably heard in the news with the boosters coming out, the pediatrics. It's a constant change and a constant pivot, but mostly we're just, I'm here, my team's here for the health of the community as a whole.
Well, absolutely. And so I'm glad that Kitsap Public Health is coming on to have these conversations because the conversation, the information is ever changing. And sometimes by the end of the day, there's something new out. So it's good that we can touch base and give access to the community in this way. So as always, viewers, if you have any questions, you can go ahead and type those right in the chat. And Lindsey will do her best to answer them. If she needs to do some research or something like that, she'll let you know. Let me get back to you on that. And then next time we have a show, we will go ahead and do that. So I'm going to go through and we're just kind of ask you a few questions and kind of go from there. Sound pretty cool?
Sounds great.
All right. So, the first one is, can you give us some information about vaccination for children under 12? Like what's going on with that?
Yeah, absolutely. And I've got a personal interest in this as well because I have an 8-year-old and a 5-year-old, so they're coming up eligible. So there's a lot going on in the pediatric 5 to 11-year-old front. So the FDA tomorrow will be reviewing Pfizer for emergency use authorization. Now, it's not just reviewed and then it's out to the public the next day. There's a process for safety that the vaccine will go through. So once the FDA reviews it, they would give their recommendation. Is it going to be for all children 5 to 11, specific children, that kind of thing. At that point, it will go to the CDC for review. And something that the Western United States, there's something called a Western work group that it goes to another step process where it's going to get reviewed before it goes to our Department of Health. And then after Department of Health signs off on it, then we would get it at the health district so we could start distributing. So as far as that goes, we already are in the process of receiving some pediatric vaccines for COVID for Pfizer in anticipation of approval. So we are expecting it to be approved and go through those steps. And we're working with local providers to make sure that we can get vaccine out to pediatricians, family practice offices, as well, just making it accessible in the community. So I'll also say that the dose that we're going to be giving our 5 to 11-year-old, we anticipate it's a smaller dose. It's the same vaccine, but it's a third of the dose. And that's because their immune systems are not as mature as an adult. So we want to be really careful about the safety of that. So yeah, that's kind of sums up what's going on. So we're all anxiously waiting as those boxes get checked and anticipating and preparing for supporting the community.
So to clarify on that, Lindsey, the vaccine will be for children ages 5 to 11, and it's a third of the dose that adults get. So there's no change in what's in the vaccine. It's the exact same thing. It's just a smaller dose for smaller bodies, basically.
That's correct, Marwan. Just a smaller dose. It will come in a separate vial, and that's for vaccine safety and administration. So I know that makes me feel a lot better. It's not
Mhm.
going to be pull a couple of adult doses off, pull a pediatric dose. It's going to be very specifically and carefully run.
And you said that you have a 5 and an 8-year-old,
I do, yeah.
and so are you intending on getting them vaccinated, if I can ask?
Yeah, sure. So I am. I know they have mixed feelings about it. They don't love needles, but I am, and that's part of my process of trying to really research these vaccines and the efficacy. The way I see it is that we're going to either get COVID or get the vaccine, and I want my children to be armed up and ready to fight that vaccine, fight with the vaccine to fight COVID off the best they can with that tool. And also, I don't want them to be like a vector of transmission to pass it on to someone else. So I'm planning on them getting it. Again, they're more uncertain than me, and there's definitely some concerns. I've been diving down to address my own questions and that what I'm hearing from friends and others. But
And
but
and just
yes,
to clarify also, even if you're vaccinated, doesn't mean that you're not gonna get COVID, it just means you're not gonna have as a severe case.
yeah, that's a good thing you bring up. So so you can these vaccines, in a way, the COVID vaccines have been asked to do kind of the impossible because what they're set out to do is to prevent severe disease and to prevent death, and they are doing that at very high percentages, like up in the 80s, 90 percentages. What they don't do is keep us from getting COVID at all, because there are what we'll call breakthrough case, where if I was around someone who had COVID, I'm a fully vaccinated person, is it would enter my body, could aerosolize through my nose, through my mouth, and then it would take a minute, and my body will remember, oh, I've seen this before. I have a vaccine. I have the antibodies to fight it off. It starts to fight it off. I would test positive for it. There's a much shorter time that you can transmit because your body's kicking it off quick. You're vaccinated. But unfortunately, you still could be a vector in transmission to someone who's unvaccinated, and it could be harmful to them. And that's where we saw the masks come back in the summertime. So it's, and honestly, Delta variant was quite a wild card because it's twice as transmissible. So it really gave that uptick of someone who's vaccinated passing it. But yeah, there are some breakthrough cases. However, I'll say that majority of the hospitalized COVID cases and also the deaths are unvaccinated individuals.
I would love to maybe have you share those numbers on another podcast, because I think a lot of times when folks hear the majority, they're thinking like maybe 60 or 70%, but it's like in the 90s, right? I mean, it's super high. And it looks like you're looking for that now. So I'm gonna
Well,
share.
I actually have a screen up. I know I have our health district screen up. I could tell you, on maybe a good place to direct folks to go would be on the kitsappublichealth.org
Mhm.
under COVID-19 information. We have a data dashboard, and it's updated weekly by our epidemiology team, and there's a tab to look at hospitalizations and deaths. So rates by hospitalization and vaccination status, and see, this one was just updated this past week. So in the past 30 days, people aged 12 to 59 who are unvaccinated were 15 times more likely to be hospitalized for COVID-19 than those who are
Wow,
fully vaccinated.
15 times.
So yeah,
That's a huge number.
yeah. So I don't know if there's any other numbers in particular you wanted me to pull out, Marlon.
If there are, um, so when you say 15 times, right? I mean that's huge. But what are we looking at? Let's say there were, let's say, 1,000 people in the hospital in the last 30 days. How many of those 1,000 people were people that weren't previously vaccinated?
Yeah, well, I can say the number that we have. So for 12 to 59-year-olds, as far as hospitalization, the 1.29 fully vaccinated versus 18.71 who are unvaccinated, and that's the younger crowd. Now, when
Mhm.
we get to 60 and over, there's a 9.3 unvaccinated, but 45.3 unvaccinated.
You mean
Uh,
9 point vaccinated and 45 vaccinated or unvaccinated?
so
Say that number again.
45 unvaccinated versus the 9 fully vaccinated.
Gotcha.
So
Okay.
quite a, yeah, sorry, I might have said that wrong. Quite a disparity. So
Well,
yeah.
that's pretty huge. And I didn't know, Lindsay, if you knew, but I got my second vaccine in back in May, and uh, unfortunately, I had a breakthrough case, right? And so I got really sick, but I wasn't hospitalized. And with the comorbidities that I have, I honestly believe that I would have been in the hospital or worse. I really did get pretty sick. And Dr. Morrow came on after I had come through it, and he kind of graded me on what I did to take care of myself. And so some of the vitamins I took, he gave me a B plus, and then he downgraded me to a B minus because I wasn't doing enough self care. But it's really, I definitely believe in it for sure. And you could be one of those breakthrough cases. So I definitely didn't want to end up in the hospital. And that was a conversation between myself and my doctor. And you know, when the vaccine first came available, I was pretty wary, like a lot of Americans are currently, and so I wasn't immediately like, yeah, give me the vaccine. And so I had to have these conversations with people that I trust, like you and Dr. Gibb and others in the community, and listening to the research and having conversations with my internal medicine doc, who has been my doctor probably for about 15 years. So, it's like, well, I trusted you for 15 years. I think I can trust you now, right? And you're kind of
Right,
weighing,
right.
all things can have side effects, but you've got to weigh what's worse. And so for me, it was like getting the vaccine was way lesser of the two evils. And sure enough, I ended up getting a breakthrough case, and I'm glad that I was vaccinated for it. So I think that made a huge difference.
Yeah, well, I'm glad to hear that you're doing okay. I'm sorry that you got sick. But that's really great that you were vaccinated. Yeah, I've actually personally lost a family member who was, in his 40s without comorbidities, and he was not vaccinated, but he passed away in September. And he was someone that wasn't against getting vaccinated per se, just hadn't got around to it, was kind of waiting on the FDA approval, which now Pfizer is fully FDA approved for adults. But it really hit him a lot harder, and that was really, for me, even seeing COVID firsthand, and like in what I do, I was shocked at the way that he got sick and how he responded. And I see that in the hospital as well. It used to be with the variants before Delta. A lot of healthcare providers, oh, they're going to kick this. We see this, they turn around. But what I saw in especially the months of August and September in the hospital is that the folks that were previously kicking it, especially if they're unvaccinated, that 15 times higher rate locally here in Kitsap, that they just weren't getting better, and we see them go down this progression to the ICU, and honestly very dire and very hard to see. It felt kind of a feeling of hopelessness among a lot of the nurses and doctors.
Well, Lindsay, I'm sorry for your loss. And you say something really important. It's like, you don't know how COVID is going to affect you. This is a 40-year-old man who's healthy, um, and it ended up, costing his life, unfortunately, or tragically, really. But then there could be someone who is unhealthy. One of my, I think my only board member that's not vaccinated has a lot of morbidities also, and he got COVID, and he was pretty sick, but he came through it. And so you don't know how it's going to impact you. So thinking, hey, I'm of this paragon of health and nothing can touch me, is just not the case. So you just don't know.
Yeah, and that's a really good point. And I'll say someone else that I know, one of the most healthy, like he's a bodybuilder, and he got COVID in August and unvaccinated, and he ended up, he's alive. But he ended up with myocarditis and has like a heart monitor he has to wear, and he's definitely not back in the gym, and we're 2 months later now, so he definitely had some scary times there moving forward. Like he would get winded just walking up the stairs and things that were easy for him prior.
So let me ask you, Lindsey, as they are, the one vaccine is FDA approved. If you had a choice, which one would you want your children to have? Does it matter?
Right now, yeah, good question. So right now, the only one that feels like it's on the table for me is Pfizer, and that is the one going through this FDA CDC process. And it's also the only one that's been given to anyone under the age of 18. So Pfizer, we don't have a lot of choice right now as far as pediatrics children. So I would say Pfizer is what I'm going with.
Gotcha. And when might that get full approval to where kids can get vaccinated?
As far as for the Pfizer vaccine,
Mm-hmm.
we're looking at early November.
Oh, okay.
There was a lot of hope to have it by Halloween, to do maybe like a trick or treat kind of event, but it doesn't look like we're going to quite have it ready to put in arms by then. So.
Well, that's a hell of a trick or treat, right? It's like, hey, kids, get some candy and a shot.
Trick or shot, yeah.
For all us morbid parents out there, it's like, yeah, come on, let's go get some candy. Yeah, you just don't have any idea what you're in for. So, my daughter, she turned 10 on the 5th of this month, and uh, she wanted to, like, Daddy, can I just say that I'm 12 and get the vaccine? So, she's one that wanted the vaccine, and a lot of that was, one, she wanted to be safe. She's a little fearful of what she hears and sees, but then also she didn't want to have to wear a mask, and now we're kind of back to wearing the mask again. And she does a really good job of wearing her mask. So, we've talked about that as a family, and we're going to go ahead and get her vaccinated when it comes available. But it is kind of scary, right? Because you hear all this information out there, and it's like, okay, well, is there something to this? It's like, but you really do have to do your research and have your conversations and do what's best for you. So, yeah, that's what we plan on doing. But let's switch. Let me ask you one other thing. Potential concerns that parents may have with getting their children vaccinated. Do you know what some of those are, and can you speak to some of those?
For sure, yeah, and I definitely have, although I do encourage vaccination for almost everybody, but I'm not without questions and concerns myself. And even I had posed to some friends of mine. I started doing some really diving into the pediatric research, and some of them were worried. They don't want to tell me what their fears are. And I said, listen, you can be honest with me. Do you have concerns? I want to hear them, because I want to know, to help educate the community, what concerns are real and what aren't. And there are real concerns, and there are some that we can kind of let go. And there's always going to be a degree of unknown, because it's all, like you mentioned, Marwin, like it's at risk benefit analysis. So what are you at higher risk for? Your child getting COVID and what's going to happen with them getting COVID, or is it with getting vaccination? So, one concern that we hear is that there's, and this was similar with adult as well, as a perceive of a rush or a rush rollout. And I will say that rushed is different than speed. And there was definitely a speed with the vaccines, but just to know that, the research on these mRNA vaccines started back in 1961, and then there
Oh,
was this
really?
clinical trials, yeah, 1961 for the mRNAs. So then there's clinical trials on flu vaccine for mRNA back in the early 90s. And, they've been tested for, the science was in place leading up to this. The thing is with the mRNA is it degrades quickly. So in the trials, it'd be put into, the body, and it would degrade quickly before it could even get into the cell and teach it how to make this, spike protein or whatever it is we're trying to make. And so what they did was they created a fat bubble. So you've got the mRNA, and they encapsulate it in a fat bubble, which once it's put in by the vaccine, that gives it enough time to enter into the cell through that outer layer of the cell, the phospholipid bilayer, and go through that can get into the cell, the cytoplasm. It doesn't go in the nucleus. It doesn't mess with the DNA. It gets in there into that outer part of the cell, teaches your cell how to create the spike protein, which is that piece of the, really like a piece of the coronavirus that's gonna put into your body. It's not actually COVID. Then it tells your body, let's create some antibodies. Let's create an immune response. That's why some people say, hey, I got my shot. I felt kind of like I had a mild flu for a day. It's gone. That's good. Your body's creating an immune response. So then when you come into contact with COVID, it's going to kick it off. But anyway,
Can you state that again really quick? Because we had one of our folks get her second shot on Thursday, and the next day it wiped her out. And so she had never gotten the chills before being sick, and she had a massive headache. And he was like, "Whoa, the first shot didn't make me feel this way, but the second one definitely made me feel pretty sick." So you're saying that's actually kind of a good thing?
it is actually, yeah. I mean, I know none of us like discomfort, but it's way less than what you'd experience if you got even a more mild case of COVID. Like Marwin, like even getting COVID, it's no fun. But yeah, actually getting a bit of an immune response, so getting a little bit of that chills or fatigue or kind of achiness, we hear headache a lot. That can be, that's actually a good thing because that's your body creating that immune memory. So yeah, I kind of was hoping for a bit of immune response myself. I know some get it a little more. We all have different sensitivity to that, but yeah, just to rest assured that the vaccines did go through all the phases of trial. Back to your question about concern. So while things felt fast, it wasn't a rush as far as corner cutting.
Okay. And I know that's been a lot of folks' concern on that. It's like, oh, this thing was just whipped up really quick, and you can't trust it because it came so fast. So 1961, that's good to know that this isn't that new. It's actually pretty old, right? They've been working with this stuff for a while, so um, that's a little comforting on that side. Let's switch gears a little bit. I've been watching the news, and I hear there's now this Delta Plus variant of the Delta virus. So, are there any cases of that in Kitsap County? Can you inform us on that? Is it more infectious?
So you're asking about the Delta variant in
The,
particular?
the Delta Plus. I heard that there's like this Delta Plus that's kind of going around a little bit. And I don't know if it's local here in Kitsap County, but I think UK is where it's kind of popped up right now.
Marwin, I'm gonna have to do more research into the Delta Plus in particular. I haven't heard of that circulating here in Kitsap at this point. I will say that something called genomic sequencing is done on certain cases so that we can track. And there's a link on the CDC I can send you separately so you can get it out to your listeners, however, whatever platform you need to. But something called genomic sequencing is done to determine what the predominant variants in a region are. And yeah, the last I heard, it was still Delta, the regular Delta, and not Delta Plus. And we saw these dramatic spikes in August and September in those hospitalizations, deaths, as well as cases. And we have seen a bit of a decline, thankfully, in October. So whether it's infected a lot of people, we've seen an uptick in vaccination, all the different reasons why these variants, they spike up and then we start to see that downtrend. But I will look into the Delta Plus. That's a good question. I'll follow up with you on that.
Now you're super smart and technical, so I want to clarify this again because I never understood how do they find out what's alpha or delta, or I think there was the mu variant. So they take random people that are sick and they do genomic sequencing to figure that out.
Yes, they don't send every single person who gets a COVID test. It's not sent out to see, is this Delta or is this Alpha or one of the others. What they do is they'll take a sampling of the COVID test, and those are sent out for genomic sequencing. And then it's really like a larger kind of a larger view picture that's taken on regionally to see what the predominant variant is. But it wouldn't be it wouldn't be useful to send out every single test, and that would be quite labor and cost and time ineffective. So yeah, I can send you more info on it. It's pretty in depth. I've recently dove into learning a little bit of that.
Sure. Well, and then it sounds like too, when you're doing the sampling, if there was Delta Plus that was here in the region, it would have come up through the sampling or the Mu variant, which I think a month ago was like this thing down in South America or somewhere else, but it never really caught on here. So, they were like, oh, the Mu variant, here it comes, and it just never really materialized because it seems like the Delta variant is just so infectious that nothing else can overtake it right now, which hopefully remains the case and this thing doesn't mutate any further. So we can keep our fingers crossed on that, sounds like.
Yeah, absolutely.
But what I was going to ask you to do, Lindsey, if you wouldn't mind typing in that private chat there, the link to the Kitsap Public Health website where you got that data from earlier, and then I'll put that in the chat so our viewers can go ahead and link on to that. I think that would be good. And then I had a couple optional questions for you. Are you okay with answering those?
Yeah, absolutely. I will give you my best shot at them. I don't know if I can give you a solid, clear answer on them, but we can talk about it.
Sure. All right.
Let me see about putting that website in the chat here.
Got it.
I'm not as familiar with your platform, if I feel a little.
No worries. So again,
yeah.
You are watching The Conduit. It's Monday, and our guest is RN Lindsey Camarena. And RN is registered nurse. BSN, I believe, is bachelor's in nursing. And then what is CMSRN?
So that's actually, I'm a certified med-surg nurse. So I have a background before my ICU time on a med-surg floor. So just a certification I got, and I guess it gives me some fancy letters behind my name.
So modest. Oh, it's just a certification that I have. It's just a weekend. Now it's a lot of hard work, right?
I guess that's true.
That's a lot of hard work. A lot of studying. That's definitely not me. It takes a special person to get into these fields and follow that through all the way to the end. And then you're a lifelong learner, right? You've got to continue to learn.
Yeah, absolutely. It's a lifelong process. Definitely, I'd say COVID's keeping me and everyone on our toes just to stay up to date. My birthday was over the weekend. I took Friday off, and I feel like I may as well have took 2 weeks off with the amount of information that came out.
Did you say your birthday was this weekend? Over the
Yesterday, yeah.
Oh, happy birthday! Happy birthday to you for sure.
Well,
And
thank you, Marlon.
steadily working. So that website is kitsappublichealth.org. There's a lot of good information there. It's pretty intuitive. There's lots of little data in there. You can click on different boxes if you want to look at age range and different things there. I've done a podcast several months ago where I actually went over the website. So you can look back on those or just check it out and see what's up to date. So the couple of optional questions that I have for you, Lindsey, one was, can you give us an update on the vaccine mandate in Kitsap? What are your thoughts on that? And do you have any information on that?
Yeah, sure. So I will say that right now, as far as vaccine mandates, it's just for specific groups of workers. So like the healthcare mandate and for public educators, that kind of thing that date has passed. So that was October 18th as a deadline to be fully vaccinated. And I know that over 90%, upwards to 95% of those groups were vaccinated. And I know that some of the businesses are working with individuals who are planning to get vaccinated. Maybe they're taking leave of absence while they're getting vaccinated, that kind of thing. So those are the only mandates I know of so far. As far as I know, the shipyard as well is mandating vaccine by November 22nd. There's no widespread mandate in Kitsap County at this point. Mandate continues to be discussed on the Kitsap Public Health Board meetings, which are live streamed and recorded. They took public comment at the October meeting, and I know that they anticipate to continue to discuss this. Right now, where we're at as far as Kitsap Public Health. So we don't, we don't make mandates here from the health district. We would give recommendations. And as far as what we're doing right now is we're talking with the Kitsap Economic Development Alliance, and we're really trying to get them on board with encouraging businesses to make public what they're doing for COVID precautions. So maybe to publicize or post up somewhere like, hey, like we're 89% vaccinated for our staff, or we have social
Nice.
distancing, we have these cleaning measures in place. Just we have DoorDash type options or curbside pickup. So we're really encouraging that because vaccine mandate, as Gib Morrow likes to say, our health officer, it's Plan Z. It's not Plan A, B, C, D, any of that. Nobody wants a mandate. And I think we do hear folks speaking out loudly against mandate, and I completely hear them. And like freedom of speech, like absolutely. But I want to say maybe why we don't hear people pushing back the other way is because while people really don't want to mandate, I don't think there is another side. I don't think there's a side that really wants a mandate. I think a mandate feels really negative and feels bad. But the thing we have to ask ourselves is what is going to keep people alive and keep people safe. And so it's a continued discussion, but there's no mandate that's widespread at this point in the county.
You said something earlier. You said something about 95% of like the federal were vaccinated in Kitsap County. Did I
You
catch
know,
that?
I will say that in the hospital, I heard it was in the 90s. I don't want to give you, I don't know an exact percent as far as overall. I know it. I've heard some snippets of what it is like per different school districts and that kind of thing. But I actually don't. I have not seen the official numbers.
Gotcha. And so, and the reason why I bring that up is we see a lot in the news and the media. We see it. There was a protest on the bridge and some other ones that we've seen here locally. And I think what gets missed because you're covering the news, right? And you need ratings. You're going to cover the folks that are out there protesting, which is good. You should cover that. But the majority, overwhelming majority, we're not talking about 51 or 57, not even 60. We're talking about 80s, 90s% of folks, have gotten vaccinated. And so I think the media has done a disservice in the sense that it makes it look like there are like it's almost a majority of Americans don't want to be vaccinated. And I don't think that's the case at all. So it's good to hear those percentages like that because you're giving counter data to what's being put out there, right? Because it's so sensationalized, right? They want people to tune in and watch, and I think it just kind of perpetuates this unfortunate negativity. And like you said, I think you are probably very accurate in saying, there really isn't another side. People don't want to be forced to vaccinate. And people do have valid concerns on why they don't want to be, but at the same time, the overwhelming majority of folks have been vaccinated, and so that's important to put out. And I think that gets lost in the conversation. So I think that's really important. So I've got one more question for you. Is there any movement on vaccine passports in Kitsap County? I know, like you were saying, they have the open meetings. The last one was in October. I actually streamed that live so people can hear what people had to say in that conversation. And I know they kind of tabled it for a while, but is there any more talk on that? You're also saying that the numbers are going down here in October, which is great. I don't know what the percentage of decline is. But are we kind of moving away from needing to do a passport mandate in your opinion, or?
I'm not hearing about a vaccine like a wide sweeping vaccine mandate as far as that being really pushed or I don't know yet what the recommendation is going to be from the board. Just there's so many individuals that mayors and commissioners like that make that decision in collaboration with the health district. I know that again, like the mandates and something like a vaccine passport are not Plan A. So the cases will be evaluated at that point. And I anticipate that this is going to be part of the discussion at the next board meeting for Kitsap Public Health. But so far, I'm just hearing a more proactive push to encourage those businesses and individuals to come on board with COVID precautions and keeping our community safe.
Gotcha. And I would assume that just like with the mandate to become vaccinated, because that public health is probably doesn't want folks to be under a passport either. Is that a fair assumption?
Yeah, like we want businesses to stay open. We want easy access for everyone to to support our local businesses, to keep everybody afloat. And we're not trying to create undue burdens. It's really difficult, and I don't think that a mandate passport is an easy decision for anyone who has to make that. For example, like my brother-in-law who passed away in his 40s, like I told you, like he wasn't anti-vaccine. He was kind of just waiting, and he worked for Boeing. And now I see Boeing come out with these mandates for their employees, and part of me, I just like feel it, because I'm like, would he be alive if they mandated it 2 months ago? I think
Mm.
he would. And so while I feel mandates are hard and they're Plan Z, I also see that they save lives. And we've had a lot of folks come through the clinic who, some are frustrated, they're mandated to get vaccinated, that kind of thing, or they feel life will be easier if they do. Some are frustrated, but some say, I guess it's time. Yeah, I want to. I've got enough reasons. I never was really against it, but I definitely don't want to lose my job. I want to be able to go to these concerts, that sort of thing. So I think that, like, ultimately it's a very nuanced thing. It's not. I don't think it's cut and dry, and I don't think that there's an easy decision. So I just really value and respect our leaders who are making these hard decisions and considering all the sides.
And it really is hard, right? This isn't easy decisions to make at all. I'm definitely not envious of these folks that have to make these decisions for sure. Um, last thing is the word endemic when something like the flu is just kind of with us kind of forever. Does it seem like that's where we're going with COVID, where it's gonna be like a flu shot every year, and it's just something that we're gonna live with?
Right now it feels that way. Hearing the booster come out and that sort of thing. At least the booster recommended for certain populations. Uh, but and the hope is definitely that it turns endemic, and and that it's something we live with. And coronaviruses have been a part of. There's coronaviruses that are the common cold, and so it's all about what are these variants going to pose. Are we going to see another Delta like variant come out where we have to really be careful and increase those vaccination rates and put the mask on, that kind of thing? Or are we going to see these variants that are not as concerning, that we can just maintain vaccination, or that we don't need to get boosters every year? I just don't know, Marwan, and I think that's a hard thing. That's a hard thing with science. And I will say follow the science, but also make sure it's good science that you're looking for. So not every site that you look at, not every click on social media is accurate, and so you want to find a trusted site. That's something like a scholarly site. One of my friends recommends going to Google Scholar. Look at like the .org or type thing. .com is going to be more commercial focused. You want to look at the about section on a page and see what their goals are. Is this a company that has a big financial incentive or other? You want to look at the bias, and you want to try to find a peer-reviewed source. So it's tough. It's a lot. I sometimes feel like you need an advanced degree to follow all this stuff. Our Kitsap Public Health page that I put in the comments is a very good place, and especially like if you look at other local health jurisdictions around the state, even like I'm not the one that updates the site, but I'd say our team here does a pretty good job. It's very easy to navigate, but just trying to stay up on it and make the best decision you can for your family and for yourself is to stay safe. And we're always willing here at the health district to help answer questions. we're
And
here for you.
I definitely appreciate it, you coming on and having this conversation. And, it's like ask questions. And I think a lot of folks, they have these questions, they have these concerns, and who do I talk to? Who do I trust? Who can I reach out and actually get some answers from and get some places to go to get, other research. And it's also good to see that you also have your concerns, right? You're concerned for yourself, you're concerned for your children, and so you continue to do research even as you are in the field. And so with that, do how do we address you? Are you you know Nurse Lindsey? Like, is there a title to address you as?
I go by Lindsey, pretty casual. Yeah, I guess nurses we're usually first name basis, and most of us here in the health district are our first names. We're public servants ultimately, and so we want to be. We don't need to be put on a pedestal. We're right down here with you all. Like, we're serving our community. We're real faces of our community, and this is what we signed up for. So I'm fine with just Lindsey.
Well, Lindsey, Nurse Lindsey, we so much appreciate you coming on today. I'm going to give you the final word. I look forward to having continued conversations with Kitsap Public Health, and want to get into. I don't know if you are into the NBA at all, but like there's this a lot of drama around Kyrie Irving of the New Jersey Nets because he doesn't want to be vaccinated, and I think it'd be great to kind of have those conversations that are relevant, things that are going on. Lisa Warren in the chat says thank you, but I want to give you the final word, Lindsey.
Yeah, I'll just say, we all make the best decision that we can right now with the information that we have on hand to the best of our ability. And I just encourage anyone listening to really be open minded. We've heard about the vaccine for it'll be coming up on a year in December about the vaccine availability. But just to be open minded to new information that you might hear, and know that it's okay to change your mind. And
I love
yeah.
that. It's okay to change your mind. That's awesome advice. Um, if people do have questions, how should they reach out?
Sure. I would say that the best way to get in touch with us, I can put an email in the chat, is we have a main COVID vaccine email that they can then filter to the appropriate person, whoever you need to talk to within the health district. So I'm going to
Perfect.
put that in the chat.
All right. So while Lindsey's putting that in the chat, of course, as always, you can send questions to us and we will forward them on. So the most important thing is that you get answers to your questions. We want to be as make everything as accessible for you as possible. So with that, for Lindsey, I am Marwan. This is the Conduit. We will be back in an hour and 15 minutes with the executive director of the Bremerton Housing Authority, Jill Stanton, and Matt Garrett, if he's fully recovered from Kitsap Community Resources. So we look forward to having Kitsap Public Health on next week. Thank you so much, Lindsey.
Thank you.
All right. See everyone soon. Bye-bye.